Artificial Intelligence Doctor www.abcpharma.net/English. User question: what can tell a patient the Abbott Merlin programmer? Cohere answer: the Abbott Merlin programmer is a specialized device used for the interrogation, programming, and optimization of Abbott pacemakers and implantable cardioverter defibrillators (ICDs). Here's a detailed explanation that you can share with a patient. Introduction. The Abbott Merlin programmer is a sophisticated device used by healthcare professionals to communicate with and adjust the settings of your Abbott pacemaker or implantable cardioverter defibrillator (ICD). It plays a crucial role in ensuring the optimal functioning of your device and your overall cardiac health. Key functions. The Merlin programmer allows your doctor to retrieve important diagnostic information from your pacemaker or ICD. This includes data such as battery status, pacing thresholds, and the number of pacing or defibrillation events. By analyzing this information, your doctor can assess the performance of your device and make any necessary adjustments. Safety and security. Abbott places a strong emphasis on safety and security. The Merlin programmer incorporates advanced encryption and security protocols to protect your device from unauthorized access or adjustments. Only trained healthcare professionals with the appropriate credentials can use the programmer to make changes to your pacemaker or ICD. Device interrogation and optimization. During a follow-up appointment, your doctor will use the Merlin programmer to interrogate your device, which means they will retrieve detailed information about its functioning. This data helps them understand how your device is performing and make any necessary adjustments to optimize its settings. This process ensures that your pacemaker or ICD continues to meet your specific cardiac needs. Real-time monitoring. The Merlin programmer provides real-time monitoring of your heart's electrical activity, allowing your doctor to observe how your heart responds to different pacing or defibrillation settings. This real-time feedback is valuable for fine-tuning the device's parameters and ensuring its effectiveness. Battery management. The programmer also helps your doctor monitor the battery status of your pacemaker or ICD. By regularly checking the battery voltage and impedance, your doctor can estimate the remaining battery life and plan for any necessary device replacements. Regular follow-up care. Regular follow-up appointments using the Merlin programmer are an essential part of your long-term cardiac care. These appointments allow your doctor to ensure that your device is functioning optimally and make any adjustments as your cardiac needs evolve. It's important to adhere to the recommended follow-up schedule to maintain the effectiveness of your pacemaker or ICD. In summary, the Abbott Merlin programmer is a versatile and secure tool that facilitates the management and optimization of Abbott pacemakers and ICDs. It enables healthcare professionals to retrieve diagnostic data, adjust device settings, and ensure the long-term effectiveness of these life-saving devices. Regular follow-up care using the Merlin programmer contributes to the overall management of your cardiac health. Claude. The Abbott Merlin programmer is a device used by healthcare providers to communicate with and adjust settings on Abbott's implantable cardiac devices, including pacemakers, implantable cardioverter defibrillators, ICDs, and cardiac resynchronization therapy (CRT) devices. When used with a patient's implanted Abbott Avir leadless pacemaker, the Merlin programmer can provide the following information and perform various functions. 1. Device identification. The programmer can retrieve and display the unique identification number, model, and serial number of the implanted leadless pacemaker. 2. Battery status. The programmer can show the current battery status, estimated remaining battery life, and any battery-related alerts. 3. Pacing parameters. The programmer can display the current pacing settings, such as pacing mode, base rate, rate responsiveness, and output amplitude. It allows the physician to modify these settings as needed. 4. Pacing thresholds. The programmer can perform pacing threshold tests to determine the minimum energy required to consistently pace the heart. This information helps optimize pacing output to prolong battery life. 5. Sensing parameters. The programmer can display the sensing configuration and sensitivity settings of the leadless pacemaker. It allows the physician to adjust these settings to ensure appropriate sensing of the patient's intrinsic heart rhythm. 6. Diagnostics and statistics. The programmer can retrieve and display diagnostic information, such as the percentage of paced beats, sensor rate histograms, and arrhythmia logs. This data helps the physician assess the patient's condition and the leadless pacemaker's performance. 7. Alerts and notifications. The programmer can display any alerts or notifications related to the leadless pacemaker's function, such as low battery, pacing impedance out of range, or suspected device malfunction. 8. Firmware updates. In some cases, the programmer may be used to install firmware updates to the leadless pacemaker, ensuring that the device has the latest software and features. The information provided by the Abbott Merlin programmer is intended for interpretation and use by trained healthcare professionals. The programmer communicates this information to the physician or technician operating the device, who then uses their clinical judgment to make decisions about the patient's care and treatment. Patients with Abbott Avir leadless pacemakers will not directly interact with or see the information displayed on the Merlin programmer, but their healthcare provider can explain the relevant findings and any necessary adjustments to their pacemaker settings.